I would like to continue and from where Dr. Lee has left off, and we are talking about HIFU treatment in Singapore. Of course, as we all know, Dr. Lee is the pioneer, and we all know that this is a new treatment for fibroids and adenomyosis. The good thing is that this is non-invasive, non-surgical, the day procedure, very little or no downtime at all. And the patient, I literally tell them that they can actually the next day jump off the bed and start walking, running, because there are actually no surgical scars on the abdomen. We all know how HIFU works. I think that has been explained by Dr. Lee. We all know the benefits also, and it takes about a couple of months for the symptoms, and then of course we know that the fibroid will shrink over time, and its literature has reported the shrinkage is up to 70 to 80% volume reduction over a period of 1 year. Okay, now let me go on to this. Okay, so I just want to go on to the development of HIFU in Singapore. We started off in 2018, and this was the installation of the HIFU setup at Farrer Park Hospital Day Surgery Center. To date, the total number of doctors who have been trained in Singapore is about 12, and the total number of doctors who have performed the procedure is about 10. So it's quite a good uptake, and which means that the penetration of HIFU is quite acceptable. The total number of HIFU procedures done up to this year, December, is 173. In terms of gynecological procedure, of course, Dr. Lee is the most number of cases. If we are looking at the breakdown of cases, then fibroids, we have 115. For adenomyosis, we've got 44. For both adenomyosis and fibroids, we've got about 10. And then 4 others, which included patients with liver and pancreatic cancer. So don't forget that HIFU can also be used to treat symptomatic advanced cancer. So besides fibroids and adenomyosis, this is also an adjunct to treating malignancy as well. So far, in all the cases that we have done, there have been no skin burns reported. In terms of total serious adverse effects, there was one, and this was a patient who reported a L4 nerve root radiculopathy. Basically, she complained of foot drop after the procedure, but she had complete recovery after 3 months, and she's back to playing badminton and moving about and so on. We've had a total number of 6 pregnancies after HIFU, of which 3 came from fibroids and 3 came from adenomyosis. And of course, we also need to know the number of repeat treatment, and so far there have been 3 patients required repeat treatment. Now, we were doing quite well. If you look at numbers, we had 173 up to the end of December 2020. And all of a sudden, there was actually a MOH review, and in the year of this year, in January, they came out with a guideline. We stated that HIFU should be considered an experimental procedure based on the NICE or NICE guidelines, and instead, the category stated that ultrasound-guided HIFU should be done in the research or clinical trial setting, but at the same time, they were comparing ultrasound with MR-guided HIFU, and they actually stated that MR-guided HIFU, on the other hand, has sufficient evidence on the safety and efficacy to support its use as a clinical service. Of course, I will go into a bit more details into the NICE guidelines later on, just to dissect what is the difference between MR guided and ultrasound guided. But of course, with this guideline, it had a big impact. You know, if you say that this is considered experimental, then there are a few implications. It means that we can no longer offer it as a clinical service, which means that there's an immediate stop to HIFU in Singapore after having done over 170 cases. So there was an appeal to MOH, and MOH had a look at the evidence, and of course, the audit of the cases was provided to MOH, and therefore they came out with a revised guideline in May 2021. Under the revised guidelines, HIFU can be allowed under certain constraints, but it is not MediSafe or MediShield claimable, which means that the patients cannot use their own so-called Medicare savings in their own accounts, nor can they actually claim from the insurance. Now, this will make HIFU in Singapore very formidable to perform because, as we all know, in Singapore, there are rising costs. And of course, any hospitalization is expensive. And to ask the patient to solely bear the entire cost themselves is probably a near impossible. So therefore, there was a big plunge in the number of cases. And so far in the year 2021, this year, we had only 2 HIFU cases done so far. So from averaging at least from over 60 cases a year, now we are down to 2 in this year. That is not a very good sign. The evidence, this can be submitted to MOH, and there can be a review of the guidelines again. The most important is, of course, the issue of the insurance claim. And once you say that you cannot claim, it is, like I said, near impossible for any patients to go ahead with the procedure because it will be all out of pocket. But with this, I'd just like to go through some case studies on why I have done
Hi, Dr. Yoke, are you there? Can you hear me? Anybody can hear Professor Fong?
why I've embarked on HIFU and why I think.
No, we cannot hear.
Dr. Fong, there is some internet problems.
Sorry, how much of the talk was missed just now?
Just start the case. Just
started the case. Okay, sorry, I had a drop internet connection.
Okay.
So okay, let me just go back to this one here. Can you all hear me now?
Yes, of course.
Okay, can see also?
No, not yet.
Cannot see.
Cannot see the slide yet. Cannot
really?
see.
Okay, wait. Sorry, I must. I need to share screen. Sorry.
And of course, during Professor Fong talk, you can put in the chat box about your question or idea. So please join.
There's something wrong with the internet connection.
It's okay. It's okay. It's okay. It's okay.
Can you still hear me?
Not yet.
Okay. Get this. Okay. Then I'll go to this. I will share screen again.
Okay.
Okay. Can you see now?
Yes. Yes. Of course. So please.
Okay. All right. Okay, so case study 1. This was my very first patient actually. She came with a past history of having had a laparoscopic myomectomy in 2009 of a 6 cm fibroid. And when she came, she presented with abdominal fullness. And when I felt her tummy, I had a bit of a shock because there was a big mass, about 20 to 22 week size in the abdomen. When I did the ultrasound scan, I found there was a 13 cm anterior intramural fibroid, as seen in this picture over here, right? It's actually pushing the uterus right to the bottom here. So of course, intuitively, I offered her a surgical option. I said, we can go for myomectomy or hysterectomy. But the patient actually insisted on trying for HIFU. She had read about HIFU. She doesn't want to consider surgery at all. And because of the size of the fibroid, I felt that it was fair to offer her something instead of not doing anything for her at all. So we went on to progress, for the HIFU. So if you look at this, this was the preoperative MRI picture. This is before HIFU. Here you can see this is a big anterior fibroid. It's actually pressing on the lumbar spine, and it's actually above the level of the umbilicus as well. And the HIFU was done on 18th of October in 2018, and we did an MRI the next day on 19th October. You can see straight away that there is a shrinkage of the fibroid. There is actually a space between the uterus and the back of the spine now, right? And the dark area here, this is the non-perfused volume of the fibroid. Okay, so you can say that the patient had a very positive outcome result from the HIFU treatment. But this is the next day, what happens to her in the long term. Now, as we follow her up, then she related to us that she tolerated the HIFU well. There was no significant side effects, no skin burns. She straight away reported improved energy levels, probably because significant part of her energy stores were actually going to the fibroid, to feed it and to keep it viable. The patient is now 50 years old, and she's actually perimenopausal woman, perimenopausal status. And I just did an ultrasound scan for her earlier this year, and the fibroid is about 7 by 3 cm, right? So I think this is a much more manageable size, and I will be happy to just manage her expectantly and just continue to follow up. With the menopause, then there may be a chance that the fibroid might shrink even further, but at least we know that that will not grow. So I must say that for my first patient, it was a very satisfying outcome. That gave me encouragement to offer HIFU to more patients. So I will talk about the second case study. Now, this patient is a bit different. Now, she is a young girl, she's single, she's nulliparous, and she presented with heavy menstrual bleeding and also urinary frequency. Now, again, when I saw her, once she was lying down on the bed and I had an ultrasound scan, I had a big shock because this was a huge posterior wall fibroid, occupying the entire part of Douglas and pressing on the sacrum spine over here and pushing and elongating the uterus anteriorly. So my scan revealed that this was a 12 by 7 cm posterior wall fibroid. So even before considering either HIFU or surgical option and so on, I decided that the first option is actually to try to shrink the fibroid. And then we can discuss about what is possible and what's not possible. So I gave her a GnRH injection, and this is the picture of the fibroid after 3 months after the GnRH injection. So number one, you can see that it has shrunk very well, right? It's away from the sacrum now. There's a lot of space. This fibroid is probably maybe about 7 cm in diameter. And therefore, at that point in time, I felt comfortable to discuss with her the role of lap myomectomy versus HIFU. At the previous size, I felt that it was I wasn't very comfortable with offering her laparoscopic because it was very, very big and it extended the whole length of the posterior wall of the uterus. So once it shrunk, this was a more manageable size. And she opted for HIFU, which we did towards the third quarter of last year on 28th of August 2020. Now, this is the post-HIFU MRI. And you can see there's a good treatment area. The non-perfused volume is over here. So this was actually, again, a very good result with a large treatment area of the fibroid. Okay, so again, we need to follow up on the patient to see what's happening after the GnRH analog wears off. Is the fibroid going to grow back in size again? Is it manageable? What should we do for her? So I've seen her up to April this year. And if you look at the fibroid, you compare and see. Now, this was the pre-operative, pre-GnRH ultrasound. And you can see this is a huge posterior wall fibroid. Now, this is the current ultrasound, right? If you look at the uterus and you look at the shadow behind the uterus here, it is now about 6 by 5 cm, right? If you look and you compare, it is a very manageable size. So for this patient, we have bought her time, right? If, let's say, for example, it continues to grow again, then of course we will have to consider role of either repeat HIFU or the role of also laparoscopic myomectomy if it continues to grow in size. So I think these are the options that we have for this patient, and we will be, of course, looking forward to see how the fibroid will behave with time. Now, the third patient is a patient with adenomyosis. Now, she's 31 years old, she's in marriage, she's one child, and this was delivered via LSCS about 2.5 years ago. She presented with heavy menstrual bleeding and severe dysmenorrhea. And of course, when we examined her, this was a 12-week retroverted uterus with a very significant bulge in the posterior wall. So you can see here, this is obvious adenomyosis. There's no doubt about that, right? This posterior part here is giving her quite a lot of problems in terms of bleeding and also pain. So because she was young, we discussed, and of course, we talked about HIFU, and the patient actually opted for HIFU treatment. The HIFU treatment was done on the 22nd of August 2019. You can see here the post-HIFU treatment area. Not a very big area because the area by itself was maybe about 4 cm across. Okay. Now, for this patient, post HIFU, she still had persistent pain. The dysmenorrhea was not completely resolved, and the heavy menstrual bleeding was still persistent. And therefore, we had to supplement with other forms of hormonal treatment, such as Rizan and the DMPA and norepinephrine. But despite giving her supplemental hormonal treatment, she still had persistent pain. And she was on the verge of giving up, and she was talking about the role of hysterectomy and so on. And then all of a sudden, she had the positive urine pregnancy test on the 9th of November 2020. And then she was confirmed to be pregnant. She went on to have a successful delivery by another colleague in July 2021. So she was started on the progesterone-only pill for contraception. She's breastfeeding, and when I last saw her about a month ago, she had no menses yet, but no pain. Of course, she's quite comfortable now. And when I did the ultrasound scan for her, to me, it does look a lot better than the pre-pregnancy big adenomyotic bulge in front over here. right? Again, for her, it will be expected management for now. She will probably need some long-acting progesterone method for future control, such as maybe the Marina or something like that. But it just illustrates that for patients with adenomyosis, we can still buy them time. We possibly can improve to some degree the chance of fertility for them. And in doing so, of course, this again leads to more option choices for the patient. Now we come back later on, when we talk about the size of fibroid and adenomyosis, often people ask when we start treating them. To me, I think I adopt a general measure of about 3 cm and above. The size can be actually up to maybe about 13 to 15 cm, just as illustrated by my first patient, which was about 13 cm length across. Of course, the bigger it is, it equates to a longer treatment time. And sometimes this may equate to repeat treatment if it's necessary. It all depends also on the position, the site, the number, the tolerance of the patient actually, whether she's responding well during the HIFU treatment. So for example, like Dr. Lee said, if the patient keeps on responding to pain, keeps on moving, she's got hiccups or she's too heavily sedated, then sometimes it may actually slow down the treatment. Over here, we also practice pre-HIFU positioning. That means we actually try to simulate the treatment process before the treatment itself to see whether they are suitable and whether to go ahead or not. So this is to mimic what was mentioned earlier on. Both younger patients and, as I illustrated, even older patients can consider HIFU as a interim step before they experience menopause. Those who are keen to conceive, or those who want to avoid surgery, or even those who have got type 3, 4 fibroids for infertility and you don't want to do surgery. I feel that HIFU treatment, of course, has a potential to be an alternative treatment option. It definitely brings about convenience and benefits to patients. It's got a decade-long history of treatment at least, with thousands of patients and multi-centers globally. And the local development is a disappointment, to be frank. And I feel that more can be done by our societies as a whole, both APH and ISMIBS. They can help us to overcome this barrier. Now, if you look at the NICE or NICE guidelines, and this was a comparison of the guidelines. MRA was actually last reviewed in 2011, and this was actually more recent in 2019. And where it clearly states that for MRA guided HIFU treatment, there are well-recognized complications, but the evidence of safety is adequate to support the use of this procedure. Whereas for ultrasound, it says that here it should not be regarded as a definitive so-called treatment, right? Because it says that there are well-recognized complications, including skin burns, and therefore they say that this procedure should only be used with under special arrangements. And that's the current constraint that we have in Singapore now. Looking at the evidence that we have for MRA guided HIFU and ultrasound guided HIFU, if you look at this, the overview, the review done for MRA Focus in 2011 was based on about over 800 patients. And then the ultrasound HIFU was based on 28,000 patients. I mean, this is a big difference here. Both reviews carried one. No, in fact, okay. So the MRA review actually didn't carry any randomized controlled trial, whereas the ultrasound carried one RCT. And you can definitely see that it carried 4 non-RCT, whereas the MRA guided review had only 1 non-RCT comparative study, right? So I feel that to label ultrasound guided HIFU as unsafe because of skin burns is a little bit unfair, right? So I hope that, of course, the scientists can help and also probably maybe write in and be persuasive in the argument on the safety for ultrasound HIFU, even to the so-called the NICE committee or the UK guidelines. So if that, I end my talk. I'll be happy to answer any questions. Thank you very much.
Thank you for your very informative lecture. Always like your lecture. So if anybody want to ask the question, please raise your hand. We can do like a one short questions. If there is no question, I will ask. So do you have the experience about the post treatment of the HIFU? Are there any adhesion or there's anything is you think is it the complication from the HIFU?
I think the main issue that we are concerned about will be safety. And if you look at the MRI, post-MRI pictures, you have a good margin of safety. So I always tell the patients that we're actually treating the core of the fibroid, and you're actually leaving a rim of fibroid tissue around. That will make it actually very safe. Yeah, and in fact, you are actually not targeting normal arbitrary tissue at all. You are only targeting so-called abnormal tissue. Now, if we compare this to adenomyosis, if you want to compare the role of adenomyomectomy versus HIFU, personally, I would feel that HIFU is even more favorable because, first of all, there are no cuts on the uterus. For adenomyomectomy, if you remove too much, you will have problem with scar adhesions. If you remove too little, then it's not worth doing it at all. Then you might as well just do the HIFU procedure for them and then see whether the outcome will be good for them or not. So I think most of the so-called HIFU, if you keep it localized to the target area, it should be very safe. Adhesions, we won't know, but it's very unlikely. Yeah.